we know depression and anxiety are such common mental health issues, what are some things people can do for help, both in therapy and outside of therapy?
So when people come into therapy, what we're doing with them first is we're really doing a comprehensive evaluation of who they are, what their issue is, and trying to get some history on the roots of that issue. So that's something I think that you need to do with your therapist, and it's really important that the therapist has a very good understanding of what's driving the issue. But there's work that can be done outside of therapy also. I think the therapist will give a lot of ideas and suggestions as to what they think is behind the problem and what some of the things that will be helpful. But the patient can also really be doing a lot of work to try to understand it, to try to give valuable information that they can give to the therapist so the therapist can help them, and also implementing some of the things that the therapist is suggesting is critical. So it can't just be that you come to therapy once a week for 45 minutes, an hour, however long your session is, and then that's it. Otherwise it just becomes an intellectual exercise that doesn't go anywhere. It just becomes a nice conversation, but it doesn't really make a difference. You really have to implement it. You should be giving it thought and trying to take steps that are practical and useful, that can really make some positive change for the person and give them some progress. And so I think that's absolutely critical. So you collaborate with the therapist throughout the process.
So seeing it as a therapist helping you help yourself, as opposed to looking to the therapist for any sort of concrete advice or for the therapist to work some sort of magic for you.
Right. I think it's a process where two people are working together, and the patient is critical in that process in order to really move forward.